What's the difference between somebody who's a psychopath and psychotic? I am a criminal psychiatrist and I see the term psychosis and the term psychopath being used incorrectly and interchangeably all the time. I've literally diagnosed hundreds of patients with these disorders and they are completely different. Here are 5 reasons why. First, I'm going to list each item individually, then I'm going to describe them unambiguously. 1. Classification. So one is a mental illness and the other is a personality disorder. 2. The actual symptoms and characteristics. 3. Causative factors. 4. Duration. 5. Reality testing. One involves delusions and fantasy, but the other doesn't. So let me dissect these factors for you, my hungry little gremlin. Number 1, classification. So psychosis is a mental illness. It's a change of your baseline normal self due to a chemical imbalance. And in case you're interested, it's linked to an overactivity of the neurotransmitter dopamine, which acts in certain areas of the brain. Psychopathy, on the other hand, is a personality disorder, not technically a mental illness. So what I'm saying is that it's a key part of your intrinsic character and nature caused by inherent personality traits and early childhood experiences like abuse. We will come back onto that. Number 2, and by far the most important difference, is the actual symptoms and characteristics. So psychosis is characterized by a loss of contact with reality, often involving hallucinations, which are seeing things that aren't actually there, and delusions, which are false beliefs. So in my line of work, assessing mentally ill offenders as a forensic psychiatrist, my patients with psychosis often experience command hallucinations, for example, voices demanding them to attack a stranger. And the delusions they have are often related to paranoid beliefs, such as that random people are following you and want to kill you. And I have assessed some patients who end up attacking other people, including strangers, because they are in genuine fear of their life because of these false delusions. Psychopathy, on the other hand, is a personality disorder which is characterized by a lack of empathy and remorse, a disregard for social rules and norms, and a tendency towards manipulation and deceit. Psychopathy includes traits like superficial charm, grandiosity, impulsivity, and a lack of empathy, as well as lying, deceit, manipulation, aggression, and a lack of remorse for their actions. So a psychopath could be a serial killer, but equally they could be a Hollywood actor who spreads lies and rumors and actively tries to destroy the career of the next young, handsome, potential Hollywood star. Another video on that topic is in the post. Number 3, causative factors. So psychosis can be a feature of mental health illness like schizophrenia, bipolar disorder, and substance abuse, such as a drug-induced psychosis, but there's no such thing as a drug-induced psychopathy. As I said, psychopathy is caused by inherent personality traits and early childhood experiences like abuse. Number 4, duration. Psychosis comes and goes in defined periods. And we psychiatrists, we like to sound clever, so we call this remission and relapse. So for example, drug-induced psychosis typically lasts for a few days until the substance has left your bloodstream. So what I'm saying is, if you've been jumping off buildings believing that you're an angel, I'm sorry, but no more amphetamines for you. More chronic psychosis such as schizophrenia can be treated with antipsychotics. Psychopathy is permanent, as it is a part of your actual personality. Of course, the behavior of a psychopath can vary. They can choose not to be nasty and manipulative on any given day, but the potential is always within them. Number 5, reality testing. So psychosis involves a fundamental disconnect from reality, while psychopathy primarily involves a lack of empathy and disregard for social norms. In other words, somebody who is psychotic generally lacks insight. They truly experience the voices they're hearing. They truly believe their paranoid delusions. Whereas a psychopath is fully aware of their manipulative behavior, they just don't care. They are gods and the world belongs to them, and we are mere mortals that were put on this earth to do their bidding. But one thing that both people with psychosis and psychopathy do have in common, both of them could potentially one day be treated by a handsome Indian gold-toothed forensic psychiatrist who never skips leg day. I'm a professional criminal psychiatrist. Help me spread my education and righteousness. Topics that pique my interest, exploring psychological sciences, what the cause of violence is. Watch the rest of my content on TikTok and YouTube, I insist.